Okay. Well, I would like to welcome everybody today to restarting and energizing PFACs. And today's topic is choosing PFAC discussion topics. This is the last in our multi-part series on things to know about getting your PFAC going again after a pandemic. We have covered topics ranging from how to do a PFAC meeting remotely to how to invite members to join your PFAC, both patient and family members and provider members. There's been a number of these presentations. We've done about 8 of them, and they're all available on YouTube. If you want to go back and check and see them, they're all a half an hour. We promise not to take more of your day. And as I said, today we're doing choosing PFAC discussion topics. I think Armando and I, who both work with different hospitals and ambulatory facilities and other facilities around the country, helping them with their patient and family advisory councils, I think one of the top questions that we get is, what do we talk about? And that seems to us like an easy thing, but evidently it's not that easy to everybody to figure out how to select what topics you will be discussing at each of your patient and family advisory council meetings. So today we're going to cover these things. We're going to talk about what we mean by topics of discussion. We're going to look at those topics from the patient and family member point of view. We're going to look at the topics that are of interest to facilities. We're going to suggest having an annual event to determine the main topics you'll look at each year, and to have a system where you can address ad hoc concerns as they arise. And finally, the importance of keeping track and reporting back. So a topic is a subject of a conversation or discussion, and that may seem self-aware, but it can really range. And let's call out some of the topics that you may be in discussion, which is a consideration of a question, sometimes involving some informal debate. Let's call out some of those topics that you could be addressing. They could include, in the quality and safety area, they could include how you handle a CLABSI, how you handle a CAUTI. You may want to do a deep dive into your maternal health situation. Have you gotten feedback from your more at-risk members of your advisory council around their view of diversity, equity, and inclusion? What does inclusion look like to them? These are the kinds of things you could be discussing in your PFACs. So I'm going to change my view here so I can see my slides better. There we go. Topics from a patient and family point of view. Ask what is important to the patients and families. And one method to do that is to give them all sticky notes and to ask them to list the top 3 things they would like to talk about in PFAC meetings on a sticky note, and then put those up on a wall or on a board. What people want to talk about may vary by their background. So just as an example, when we had a youth PFAC at the Children's Hospital, the kids really wanted to talk about food. And we did. Every single meeting, the nutritionist brought food, and we found some important things out. Adult patients may want to talk about billing. Probably not as much on the kids' mind, for example, but we did talk about that and actually developed financial support information for families that was understandable and really helped them navigate the finances of their kids being in the hospital. So once you get all these sticky notes up on the board, this is a really common technique, and many of you have probably participated in meetings that use this. You want to group those by when they're like topics. So one person may say a word that's really similar to another person's thought, but they're using different language. So group those together, and with the approval of the patients and families, and then give everybody 3 or 2 little dots and have them take those dots and put them on the sticky note that they are voting for. And they may not end up voting for all of their own ideas, because you're asking them to pick the top ideas for you to discuss. And it may be over a year that you're talking about looking for those ideas. If you go for a shorter period of time, you'll be doing this exercise more often during the year, and it takes a fair amount of time. So you may want to set one meeting aside just for this exercise, and then address the top topics over a series of meetings that you have over the course of the year. Take one quarter, for example, and another quarter, and so on. You want to use, you may want to use a different method. Another method is that old-fashioned, just list it out on a piece of paper and have people vote. You can get really fancy and do ranked choice voting, which is big, at least in my state right now. Or you can just have them pick their top one and turn that in. A lot of times it's easier if you're having them select more than one, because that gives them the feeling like that they can consider more topics than just one. And that's important. Let's see if we can get this to move. There we go. And then the facility can choose topics too. It doesn't have to be limited to what the patient and family members bring up. There may be similarities in the topics that are chosen by the patients and families and the topics chosen by the facilities, which is great. But ways that facilities can choose topics to be discussed at patient and family advisory councils is to look at your annual safety and quality initiatives and bring those to the patients and families. Look at your board goals and bring some of those, where appropriate, to the patients and families. If you're making purchasing choices, bring those to the patients and families. There's a great story out of Augusta, Georgia, where the healthcare system there was selecting new beds. And they brought the Patient and Family Advisory Council in to look at the beds. They actually had a field trip down to facilities to look at the beds that were being proposed. And the patients and families' considerations for what they thought were the best beds included things like comfort and access to the television and access to the call button. They actually didn't pick the most expensive bed. They picked one that was moderately priced because it met their criteria for the best value. It was totally different than what the folks at the hospital thought they would do. The other things that I have seen looked at include what kind of pillows to get, what the gowns were, which gowns were going to be chosen. So those kinds of things, if patients have a say in those, then that's something that you can use in any number of ways, because you can say, well, we had patient input on this. Of course, facility design and layout is so important. We took our patient and family advisory council to a new facility that was in process of being built. And one of our members on our council was themselves in a wheelchair. She pointed out that she could not open the bathroom doors on her own, that somebody had to assist her with opening the doors. This led to a change in what doors were used, not just in this brand new hospital, but in hospitals across the entire facility, because they had been unaware that persons who were in wheelchairs could not open those doors. So having that discussion, that dialogue with your end users is so important. Another thing very important, ask how patients view those CAPS questions. And when you're doing that, don't ask them how they feel about it. Ask them to tell you what a top box score looks like. So one of the questions suggests that they answer is, do they feel like they have been listened to? Ask your patients and family members in your advisory council, what does being listened to look like? Our families said being listened to looked like somebody sitting down, but there was no place for their physician providers to sit down in the room. So we had to remedy that. And in our situation at our hospital, we kept a rolling chair that was, when not in use by the physician providers, at the nurses' station and locked so that children wouldn't use it as a toy. But a rolling chair that was taken into the room so that the physicians could be at eye level with the patients instead of standing and looking down at them from the bedside. Made a difference. It actually did improve our satisfaction scores. And ask patients how they view other satisfaction metrics that you may be using in your follow-on with your patients to determine patient satisfaction. These all take time. That's a lot of topics that we've already brought up. And you'll have to prioritize what you think will be the most important for your facility. As we suggested, you may want to have an annual event to consider the main topics that you'll be discussing. Present at that event the hospital topics that will be discussed that you've already decided based on your discussions with your leadership council. Consider having one main topic per quarter, and then divide your 3 meetings or 2 meetings into discussing having a fact presenting meeting. This is the situation right now. This is what the hospital policy is. This is the reasoning behind the hospital policy. Give the patients and families time to think about what you're saying and ask the probing questions regarding what your process has been and what your thoughts behind why you do that. Then have a meeting to explore areas of improvement that they've thought of. So now they've had a chance to think about your process, and they can offer their insights based on their experience into what may improve that. And then have a meeting that goes over those potential solutions. It's so important that if you implement those solutions, that you get back to those family members and let them know that you have done that and what the outcomes have been. Then at your meeting, select topics of interest to patients and families. As I said, you can prioritize the topics that will be addressed that year. At my hospital, what we did was select an overarching topic for the year. One year, for example, we did transitions. Another year, we did medicine management. That's when we found out that most of our family members, even those with college educations, did not know who a pharmacist was or what their job was. And it really led to big changes at our hospital in terms of letting people know they could talk to a pharmacist and having the visibility of the pharmacist on the floor be so much greater. And therefore, the understanding of the medicines that were being used increased, and so did hopefully adherence. You want to plan your agenda for your PFAC meetings so that you allow time for discussion of these main topic selections and also have time for ad hoc topics. So your agenda may include, we're going to do 15 minutes on this hospital topic and 20 minutes on this family and patient selected topic. And then you may have ad hoc topics that you fill in with that are suggested to you from people in the hospital. And I promise you that if you are having an active, engaged patient and family advisory council, word will get out in your hospital that it helps process, it makes things go better in general, and people will be coming to your liaison for the patient and family advisory council, your staff person, and asking for time at the council. You'll need a process to handle that. Another thing to consider is on these very large topics that you'll be looking at is having subcommittees that meet separately from the council to really get into the meat of your topic. So that's one of the things that we utilized was when we did transition, for example, we had a subcommittee that worked out a transition guide. And when I talk about transition, I'm talking about transitioning pediatric patients into the adult environment. And we wanted to have a guide that we put together, and this group actually wrote the guide and took it back to the council for their input, and then tweaked it in their subcommittee meeting and took it back to the council for input. Armando, you have a comment.
Yes, just a quick comment, Lisa, is that I noticed that most hospitals, most institutions, healthcare institutions have a hard time asking their council members to go into subcommittees because they're volunteers to begin with, right?
Right.
And so they're afraid to kind of ask them for even more time. But the one thing that I want to stress, and I found this to be true in every single occasion, is that the community members, especially that joined a PFAC, they want that hospital to be the best it can be in their community, right? And so asking them, they have the option to say, hey, I'm busy, I'm coaching little league soccer team or what have you, and I don't have the time. But if you don't ask, you'll never know. And that is how we've done it at MedStar, by just constantly asking them, and then they would say, oh, yes, thank you for asking me, or no, I'm too busy right now. It's important to really keep that in mind and not be afraid to ask, for members to be on subcommittees. That's what I wanted to say.
Thank you, Armando, for bringing that up, and absolutely true. And they may have time based on when the subcommittee decides to meet, which is something that the committee should be flexible enough to be able to select a time that works for everybody involved. So ad hoc topics. I mentioned that earlier. It's really important to develop a system for submission of ad hoc topics to discuss. So your liaison eventually will get phone calls and emails that say, I'd like to present this topic to the Patient and Family Advisory Council. We suggest, and if you use the H2PI system that Armando has, there'll be actually documents that he can share with you, that you have a form that may be submitted to the liaison, to the hospital liaison. So you may email that form out to the person who said, I want time at the Patient and Family Advisory Council, that details what it is they want to talk about. And then the patients and family leaders of your council and your hospital liaison will meet to work out an agenda ahead of time, ahead of the monthly meeting, and they will go over those requests. You may find you have more requests than you have time to cover, and you may have to prioritize those requests. And I know to some of you that sounds like, oh, that's pie in the sky, but believe me, it happens. And having that form will be really important, because there may be some topics that you can distribute a written query to your PFAC members by email and get email responses on, and not have to take up time at your meeting, so that you can fill the needs of the people in your hospital who importantly want to hear from patients and families. But you have to be very protective eventually of your meetings, because they will get filled up. So have a process, have a meeting, and determine what the topics are you're going to utilize. And finally, we want you to keep track of what's happening and report back. Keep track and report back. So make sure that you're keeping a list of every topic you've covered, what the points were, the main points that were discussed on that, and what the outcomes were. Those may not always be solutions, but hopefully you'll have some solutions in there. And then develop an annual report of what was discussed and what the impacts were. Now, in Massachusetts, where PFACs are mandated, an annual report is also mandated. And not all states, obviously Massachusetts is unique, not all states require that. One of the things that Armando pointed out to me was that the reports are not necessarily public. PFAC meetings are not public meetings. You do not have to share the content of those meetings with the general public, like you would, for example, a board meeting. Comments and attributions do not need to be shared. And in fact, you may want to protect the privacy of your PFAC members and say who they are in your document, but not necessarily attribute a comment to them. A member said this instead of Shirley Jones of the Partridge Family said this.
Well, thank you.
So that you're aware of what has been said, but you're not disclosing who said it. These annual reports should be available to your PFAC members, your board members, and your hospital leadership. Consider tracking metrics. Now, I know our friend Dejo is on vacation in Miami, but I know Children's Mercy in Kansas City is currently keeping track of how many people comment on each topic and what kind of engagement they're getting. They're trying to keep track also of how many comments are coming from an individual in their meeting. So this requires that they have a scribe attending their meeting, because it's too much
Thank you.
juggle to have your meeting moderator keep track of all of that. But they have a scribe attending their meetings and is keeping track of these things so that they can look at their metrics. They found their engagement actually went up with their hybrid meetings of having remote and in-person meetings, which is interesting. And tracking those metrics will help you make your case to about the PFAC to your hospital leadership. So moving on, that is our discussion of choosing PFAC discussion topics. You will be receiving in your email a PDF that lists everything I just said. It will also be available on our website, conveniently www.patientsafety.org, as well as posted to YouTube, where you can find all the topics that we previously have discussed. And I want to turn the time over to our friend Armando Nahum to talk about how you can learn more about PFACs and how to implement them, no matter what stage you're at right now. Armando?
Thank you very much, Lisa. So at the onset of the pandemic, we at H2PI quickly found out that, well, obviously we couldn't do the kind of work that we were doing, helping hospitals implement patient and family advisory council, because we couldn't be there in person as we always have in the past. So, and we also realized that this platform, Zoom or Microsoft Teams or WebEx, they're not really conducive to teaching. So we developed this particular platform. Actually, it's a software that it's from a company here in Georgia, and it's used by Coca-Cola, Microsoft, major companies. Major corporations. And we really built, it took us 9 months to build this entire journey to allow your team or hospital project team to implement a PFAC from ground zero, or to reinvigorate one. Given the pandemic, a lot of the PFACs went to the wayside and they're just getting started now to come back to their work. So this platform is based on 3 items. It's learn, do, and inspire. So what we do is we have a module where we teach you something, then we ask you to do it, to implement it, and then we ask you to inspire others by sharing, whether you've had issues with, oh, I had trouble with this, or I wasn't sure about that. And that allows for great collaboration. So if you're interested in this, we always are available to give you a demo. Just get in touch with us. My email is really easy. It's nahum@h2pi.org. And thank you, Lisa, for the time.
Thank you, Armando. And thanks to everybody who's taken the time to visit with us today. Are there any questions before we sign off? Anybody?
Thank you. This was great. I really enjoyed it.
Thanks, Barbara.
Yes, just a comment that this was really good. I got a lot out of it. Thank you very much.
Thanks, Penza. Tell your friends.
Yes, I will.
All right.
Fernandez, and I learned some new things that patient and families can be involved with. So thank you.
Thank you, Karen. And where are you from, Karen?
I'm from Dallas, Texas.
Awesome. So we about have all 4 corners of the country represented. I appreciate that. Okay. Well, I appreciate everybody tuning in, and we will have that PDF out to you, and this will be posted on YouTube soon. Thank you all, and have a great day.
Thank you.